Good morning to everybody from Geneva. There's morning here, but I'm aware that it's the afternoon in the Philippines. So wherever you are, a very warm welcome to you to this webinar. My name is Sarah Hess and I work at the Health Emergencies Program, WHO in Geneva, and I'm really delighted to welcome you to this webinar, which is a part of the WHO Religions for Peace co-hosted global conference. The webinar today is a case study from the Philippines that is showcasing collaboration in health emergencies, the partnerships between WHO, faith partners and national governments. We really are pleased to say and introduce our WHO colleagues in the Philippines country office who have really led on the design of this webinar. So it's been a pleasure to work with them. Before we get started, I'd like to hand over to Dr. Francis Curia, who is the Secretary General of the African Council of Religious Leaders from Religions for Peace. And Dr. Curia will provide some opening remarks. Over to you, Dr. Curia.
Thank you very much, Sarah. Welcome, everybody. Welcome, especially the colleagues from Philippines. We are very delighted to have this conference as a collaboration between the World Health Organization and the Religions for Peace International. I'm here representing the Religions for Peace International office, and I'm very glad to represent them here and to also participate in this webinar. Part of my role is to request all of us to start this webinar with a word of prayer, and I'll now ask everybody to bless these proceedings and ask God, whoever you perceive them to be, to help you participate in this, and call him and his presence to be with us now. So we have 1 minute of prayer. May his will be done. Thank you very much, everybody. And on behalf of Religions for Peace International and on my own behalf, I thank everybody and take it back to Sarah. Welcome, Sarah.
Thank you very much, Dr. Curia. I'd now like to hand over to Ava from our WHO country office in the Philippines, who is going to moderate the rest of the session alongside other colleagues. So thank you so much, Ava, over to you.
Thank you, Sarah. Good day, everyone. Welcome to the World Health Organization and Religions for Peace Global Conference on Strengthening National Responses to Health Emergencies. My name is Ava Batayan from the WHO Philippines Country Office. We are day 3 of collaboration in health emergencies, WHO, faith partners, and national governments. This track looks at different models of collaboration at national level between 3 key actors: the Philippines Department of Health, World Health Organization, and faith-based organizations, henceforth FBOs, to illustrate key elements of the WHO strategy for engaging religious leaders, faith-based organizations, and faith communities in health emergencies. Let us begin our webinar with an opening message from the WHO representative to the Philippines, Dr. Rabindra Abeyasinghe.
Thank you, Ava, and good morning, good afternoon, or good evening, wherever you are, this being a global conference. Distinguished participants, I am delighted to join you today in this joint WHO and Religions for Peace Global Conference for strengthening national responses to health emergencies in partnership with the religious leaders, faith-based organizations, faith communities, and national governments. I'm excited for you to hear and learn from our partners here in the Philippines, the Department of Health, the Catholic Bishops' Conference of the Philippines, Caritas Philippines, World Vision, and the Philippine Children's Ministries. I would like to take this opportunity to thank all of them for their commitment to protecting the most vulnerable during the COVID-19 pandemic. These partnerships, with their multi-level approaches and different models of collaboration, have been instrumental in ensuring a strengthened preparedness and COVID-19 response strategy. Since early this year, the national government has imposed limitations on the conduct of religious activities and church goings as movement restrictions were enforced to control the COVID-19 pandemic in the country. Churches and places of worship were allowed a maximum of 10 to 30% venue capacity. This became a challenge for the religious practicing their faith, with some being limited to Zoom sessions. WHO advocated for and supported the safe conduct of religious gatherings. Early this year, we started consulting different religious groups and leaders to see how we can help them safely conduct religious activities, protect their communities through non-pharmaceutical interventions, get mental health and psychosocial support, and use their extensive influence in communities to encourage people to accept vaccines. We worked and consulted with many faith-based groups, including the Catholic Bishops' Conference of the Philippines, Caritas Philippines, Ligapangabatan Incorporated, the Philippines Children's Ministries Network, Philippine Council of Evangelical Churches, the National Council of Churches in the Philippines, Ranao Muslim Christian Movement for Dialogue and Peace, and World Vision, among many others. We partnered with these groups to spread information on healthy behaviors through radio and social media. We also co-organized learning sessions on vaccination, protective behaviors, and mental health. A series of collaborative meetings between WHO, the Department of Health, and faith-based organizations were facilitated. This series of meetings led to the Department of Health's formal endorsement of faith-based organizations as partners of the government on vaccine demand generation and communications for COVID-19 vaccines. This is a significant achievement. One notable work we had was working with the Philippine Council of Evangelical Churches. We organized a learning session with 60 pastoral leaders representing 10 regions in the Philippines and got their buy-in to support our efforts in encouraging more senior citizens to get vaccinated. This is part of the country's Department of Health's Tutok A2 or Priority A2, Priority Elders campaign, which aims to save the lives of older people through COVID-19 vaccinations. Faith-based organizations in the country work alongside and within the communities, thus critical in adapting and translating high-level strategies into practical and meaningful actions. The success of this community engagement strategy in the Philippines is a recognition of how communities understand better their own context. They have the networks and resources to reach the most vulnerable and sometimes the excluded, individuals and groups, so that no one is left behind. We know that the pandemic cannot be addressed by the health sector alone. We must work together to make a whole of society approach to this solution. As our DG says, we need to do it all. Although COVID-19 brought unprecedented challenges, it also presented opportunities for us. We have an opportunity to sustain this partnership beyond the pandemic and ensure sustainable community-centered health services and initiatives as we transition from pandemic COVID-19 to living with endemic COVID-19. Organizations founded on faith, value, culture, spirituality, and belief are important. People engage with faith-based organizations as they grow, live, work, play, and age. Spiritual, religious, and cultural beliefs drive many aspects of society, such as social inclusion, social contracts, participation, behaviors, values, and more. Accordingly, the principles are necessary to recognize these in health emergency preparedness efforts. Engaging faith-based organizations can provide creative, inspiring, and innovative ways to bring networks together under one common goal and to get larger participation and buy-in from the community at large. We recognize that the role of religious organizations as a catalyst for health and critical sources for support and information. As we have learned in the Philippines, health and social measures must be informed by faith-based values to be effective and sustainable in stopping COVID and giving help to those in need. Putting communities at the center of COVID-19 response and recovery ensures that policies are inclusive, equitable, and reflective of the realities on the ground today and in the future. We need to meaningfully and intentionally engage and empower people, especially those disproportionately vulnerable to the threats and impacts of the pandemic. Faith-based organizations are effective partners for community engagement, given the trust, respect, and sense of purpose they have among the community. The Western Pacific region's for the future vision of becoming the world's healthiest and safest region will only be possible by placing communities at the center of our work and investing in them to have them empowered in emergency responses. Thank you very much. Maraming salamat.
Thank you very much for your encouraging opening remarks, Dr. Rabi. Indeed, this pandemic cannot be addressed by the health sector alone. We must work together to take a whole of society approach. Throughout this pandemic, our governments, religious leaders, faith-based organizations, and community partners have worked jointly and tirelessly to prepare communities to respond to and mitigate the impacts of the COVID-19 pandemic. Effective response entails that we leverage each other's strengths and networks for a whole of society approach. Faith-based partners and religious leaders have played a crucial role as trusted community leaders. They mobilize their networks and communities in sharing accurate health information, following protective behaviors or non-pharmaceutical interventions, and providing spiritual guidance and mental health support to those in need. Thus, I hope to illustrate how meaningful collaboration with these groups and leaders has supported the Philippine national government in mitigating the negative impacts of this pandemic and bringing factual and actionable health information closer to religious communities. WHO organized several meetings and learning sessions to partner with faith-based organizations. WHO believes knowledge is best cultivated when it is shared. We need to share knowledge to protect our communities. In the timeline that you see, we began in April this year consulting with the National Council of Churches in the Philippines, Ranao Muslim Christian Movement for Dialogue and Peace, and the Philippine Children's Ministries Network. We worked with these groups and learned the immense work they are doing on promoting non-pharmaceutical interventions for COVID-19 prevention in communities. In May, we partnered with Lingap Pangkabataan to organize learning sessions on mental health and COVID-19 prevention. We called our learning sessions #Faith and Action. In June, we worked with Caritas Philippines to organize another Faith and Action learning session. We mobilized faith-based leaders to promote COVID-19 vaccination and encourage religious leaders to follow minimum public health standards during religious activities. We're just going to show you some of the photos from these learning sessions that we organized in the past couple of months. Next slide, please. Thank you. And in August was very productive. We conducted a two-part series of #Faith and Action virtual learning session on COVID-19 prevention and mental health and psychosocial support with the Diocese of Cubao and the Department of Health. We aligned joint efforts with the Catholic Bishops' Conference of the Philippines, the Department of Health, and World Vision to see how we can synchronize our efforts to get more COVID-19 vaccines in people's arms and mobilize faith communities of action with focus to the elderly or our senior citizens. And as part of our robust campaign to get more senior citizens to get a COVID-19 vaccine, we did a live session with the Far Eastern Broadcasting Company, or FEBC. We aired vaccination messages to encourage vaccine uptake. To support partners in their COVID-19 communications, we held a key messaging workshop for Caritas, Lingap, and Philippine Children's Ministries Network. This workshop provided guidance to faith-based partners in crafting effective messages that will encourage more communities to protect themselves. In September, we scaled up even further and engaged with the Philippine Council of Evangelical Churches to leverage on each other's networks and strategic plans for vaccine uptake. And in November, we are thrilled to share that the Department of Health, through the National Vaccine Operations Center, released a nationwide policy pushing local governments to work with local chapters of faith-based organizations to encourage more people to get vaccinated. Our efforts would not be possible without committed partners. They are among the unsung heroes during this pandemic. Grassroots and local groups who push beyond what they have to protect their communities. So what worked? First is alignment in vision. The Department of Health and WHO acknowledged faith-based organizations as key catalysts for healthy behaviors. DOH, for instance, includes FBOs as one of their key stakeholders in their vaccine demand generation framework. This made it easy for us to align. Second, WHO had constant and consistent collaboration with FBOs to leverage their strengths. Linking faith-based organizations with the DOH paved way for more specific solutions. Lastly, sharing knowledge is a best practice. The DOH and WHO are generous to share guidance, toolkits, knowledge, and resources. Partners, after all, need actionable guidance to influence communities and behavior. In the Philippines, 80% of the total Filipino population are Roman Catholics. Around 11% are Protestants, 6% Muslims, and 2% evangelicals. WHO worked with the Department of Health's Health Promotion Bureau to partner with faith-based groups to strengthen risk communications and community engagement in the COVID-19 response. I want to take this opportunity to thank the community team of the Department of Health, Health Promotion Bureau, who have been exemplary all this time. Thank you for recognizing the efforts of our faith-based partners and formally endorsing them to the Philippine National Government's Vaccination Operations Center. And now, to share the different highlights of our faith-based partners' work on COVID-19 response, I would like to introduce to you our first speaker this afternoon, Father Dan Vicente Cancino Jr. He is the Executive Secretary Director of the Catholic Bishops' Conference of the Philippines, Philippines-Episcopal Commission on Healthcare. Father Dan, good day.
Good day to everyone. Greetings from Manila. Pope Francis, in a Vatican International Conference last April 26 to 28, 2018, encouraged people from different disciplines, cultures, societies, and religion rather, to reflect on and share their knowledge on healthcare and commit themselves. That is, to care for the sick and those who are suffering. It is from this inspiration that we come together, collaborate, and build these partnerships. We call it the Partnerships for Hope. Next slide, please. From the Catholic Bishops' Conference of the Philippines and the Chameleon Fathers, Philippines, we have these Partnerships for Hope. Since the start of the pandemic, the Catholic Church in the Philippines has been active in this missionary journey, bringing hope and love to everyone. With gratitude to all our partners, our government, non-government organization, civil society organization, faith-based organizations, and with sincere humility, I would like to present to you the Catholic Church response to COVID-19 and our effort to mitigate its impact. This may not capture the whole response, but this would be a glimpse of that beautiful journey together with our staunch partners. As we say, this is not our work, but His work. The Catholic Church in the Philippines is made up of 86 archdioceses and dioceses, from north to south, from west to east. And we are also made up in collaboration with religious congregations of men and women. I'd like to present to you this CBCP partnership in three folds. First, the dialogue. Next slide, please. Dialogue is not optional, but it is essential. It became really a source of enlightenment, of enrichment, and solidarity. There was a dialogue between the Catholic Church leaders in the Philippines and the government on COVID-19 response in the country at the early phase of the pandemic. The Catholic Church representatives also participated in different committees of the Philippine Interagency Task Force on COVID-19, especially with the different call meetings by the Department of Health. Next slide, please. The Catholic Church also in the Philippines has staged several webinars on COVID-19 preparedness and response in communities in collaboration with the Department of Health and non-government organization, and if I may add, other faith-based organization. You have here, yakapin ang bagong bukas. Let us embrace the new tomorrow. And we are together in this embracing our new tomorrow. The second phase would be a response to COVID-19 patients and health providers. The Catholic Church in the Philippines provided physical as well as mental and psychosocial support, psychospiritual pastoral care for individuals and even families with COVID-19 in hospitals and in their homes. We also provided isolation and quarantine facilities for mild COVID-19 patients not in church structures, both in parishes and in schools. Some of our schools, Catholic run schools, are transformed into quarantine facilities. To continue, at the middle of the lockdown, we also provided food, temporary shelters, transportation services for healthcare providers as well as community frontliners. There's also this provision of mental health services through our church workers. And most of our clients here are those in isolation and their families. Number 8, there's also this provision of spiritual assistance and enrichment to frontliners in hospitals and communities. Next, please. And on the area of COVID-19 vaccination, the Catholic Bishops' Conference of the Philippines released a pastoral statement on potential COVID-19 vaccine, encouraging the public to avail for COVID-19 vaccination. And this was released last January 2021. In that pastoral letter, it says that we express our support and efforts to the efforts of the national government to procure and deploy the vaccines in our country, and thank the private organizations who have come forward to help acquire them. To continue, we urge our government, go back please, we urge our government and the private organizations who have helped fund the procurement of the COVID-19 vaccines to commit themselves to a single vaccine distribution plan that prioritizes medical frontliners and those who are at most risk of COVID-19. In that pastoral letter, it was also encouraged that it is a moral tragedy if young, healthy company employees who are at low risk for the disease are immunized before doctors, nurses, and other frontliners, and before our senior citizens who are at higher risk of illness. The Catholic Church also commends the national government for considering the poor in the national vaccination program. It says they should be specially protected because their poverty makes them vulnerable to infection and severe diseases. Number 10, there's also this development of strategies to advocate an increased confidence for COVID-19 vaccination from Catholic Church by the provision of spaces of vaccination in church grounds and schools, by rolling up our sleeves for vaccination and promoting vaccination in the pulpit. The Catholic Church has tremendous influence and infrastructure to reach people in all corners of the country, the geographically isolated and depressed areas, as they say. A survey confirms that our experience in the field tells us that faith leaders play a crucial role in vaccine rollout, in strengthening the health system, and in building local resilience. They are trusted partners who work closely with communities to involve them in the process, ensuring vaccines are fully accepted. Last January 28, 2021, Archbishop Romulo Valles, CBCP president, said that he is willing to be vaccinated in public. He continues saying that if the Holy Father and Pope Emeritus Benedict XVI had themselves vaccinated, and in my estimation, it helps. If people would see me publicly vaccinated, why not? People understandably have their fear of vaccine, and that it's really needed if our being vaccinated is a big help. Incoming CBCP President, Bishop Pablo Virgilio David, expressed his willingness also, saying that my answer to that is yes, because we are partnering with our local government unit in this vaccination program. Anything that can allay the fears of the vaccine, we will offer in the church. Secretary Duque, the Department of Health Secretary, says that the move of CBCP to transform church facilities to vaccination sites will surely expedite delivery of the most needed healthcare services. And the government cannot do this alone. We need the whole of society to implement the COVID-19 immunization program. We have our different bishops in the different areas in the Philippines who showed themselves in the media vaccinated. Next slide, please. We also have the provision of human resources in provinces, cities, municipalities to help in the COVID-19 vaccination. Through the Task Force T3 of the Department of Health and with other partners, the Catholic Church joins this partnership on the area of COVID-19 vaccination by activating our network, health professionals, Catholic Church-based administered hospitals personnel, community-based healthcare workers to be part of the COVID-19 vaccination. We are present in more than 7 regions, including the National Capital Region. What are the key lessons learned in this endeavor? First, opportunity for an integrated approach. Let's try to look at the pandemic as an opportunity to prepare the future by building a healthy and just world, which involves taking an integral approach to all pre-existing global crises and not dealing with it separately. It needs an integrated approach. Second, wow, this is a very good time to listen. It has taught us to listen more, to be closer to those who are suffering. And it has also reminded us that the church plays an important role with regard to communicating the right messages, but also raising their voices in calling for more justice, more healing of economic system, and government assistance. The third is what I call subsidiarity, solidarity leading subsidiarity. To emerge better from a crisis, the principle of subsidiarity must be implemented, respecting everyone's autonomy and capacity to take initiative, especially that of the least. We can say that the principle of subsidiarity allows everyone really to assume his or her own role in the healing and destiny of society. Implementing the principle of solidarity gives hope. It gives hope in a healthier and more just future. And we build this future together, aspiring to greater things, even broadening our horizons. And the last is partnership of hope. I have never seen so much cooperation in this time. The Catholic Church working with the government, especially at the local government area, with non-faith-based organizations, with experts, with people on the ground, with communities, etc. It is really a partnership to try to drive humanity forward and to ensure that together we build a more just and healthier world. May the Lord God bless all of you. Thank you.
Thank you very much, Father Dan, for your presentation. And thank you for the amazing work that the Catholic Bishops' Conference of the Philippines-Episcopal Commission on Healthcare does on COVID-19 response. You're absolutely right, Father. I've also never seen so much cooperation, and this is why we are very pleased to be given this opportunity today to share the best practices that the different faith-based partners have done in the country, in the Philippines. I am pleased to introduce to you our second speaker, Father Antonio E. Labiao, Jr., the Executive Secretary of Caritas Philippines. Father Tony, as he is fondly called, will present to us highlights of the work of Caritas Philippines on COVID-19 and the vulnerable.
Thank you, Ava. Good day to all. First of all, I'd like to take this opportunity to thank WHO Philippines in inviting Caritas Philippines to share the experience of partnership in this global conference. So can I have some slides, Ava? I have few slides here to show to you what we have done and been doing until now. So Caritas Philippines, we have a network of 85 social action centers or Caritas centers throughout the country. And that corresponds also to different dioceses and archdioceses. So our Caritas Philippines also tries its best to respond to the COVID pandemic, to respond to the needs of the poor, especially the vulnerable, mostly affected by this pandemic. Next slide, please. Last year, I remember that was November, when we had a big conference of Caritas International based in the Vatican. There is this call, Vaccine for All. This is a call for all Caritas member organizations throughout the world. And we have around 168 member organizations. And we brought this call to the Philippines by promoting this advocacy, vaccination for all. I remember again, I called up our Secretary Carlito Galvez. He's a vaccine czar of the government, of telling him that we support his own call also for vaccination for all. So that provides us an inspiration to Caritas Philippines. Next slide. Now, last January 2021, this was the plenary assembly of the Catholic Bishops' Conference of the Philippines. They have this biannual plenary assembly, and they talk about lending church facilities, to become vaccination hubs. That the local government or the Department of Health can use our facilities. And we have thousands of parishes throughout the country, and facilities can be used for the rollout of the vaccination. So this was decided by the bishops in their January assembly, and that also provides us another inspiration to move locally, mobilizing our people in order to help the government in the vaccination rollout. Next slide. Now, this is a concrete example of how partnership is done here in the local in our locality, Quezon City. It is in Metro Manila, Philippines. This is a 4-sector partnership, and we have the Diocese of Novaliches, one of the 85 dioceses. This is the diocese where I am now assigned as also as the Vicar General for Pastoral Affairs, and also the rector of our cathedral, which the venue is for the vaccination is held. So you see in the picture, sitting down, the one in black is our Bishop Roberto Gaa. We have the Unilove Foundation as another partner. And then we have also the government of the Philippines, represented by Secretary Carlito Galvez Jr., our vaccine czar, is at the center. And we have the Quezon City local government, represented by our beloved mayor, Miss Josefina Choy Belmonte. And we have also a partner, Far Eastern University Hospital, one of the biggest hospitals here in the area, to work with us. Though these are 5 groups working together in partnership So we call it church, government, private sector partnership in order to roll out the vaccinations. So this is, I want to share this because this is a concrete way how the partnership is organized and how it operates until now, no, in our rollout. Next slide. Now, this is what we have already achieved. Officially, we started the vaccination in the area of the church. So we used the facilities of the Good Shepherd Cathedral. So the first day of the vaccination was in April 15, 2021. And in June 21, 2021, the partnership was formally made public. We had signed a memorandum of agreement defining the functions, the task of each partner. Like the church will provide the facilities and volunteers. The hospital will provide the medical volunteers for vaccination. And then the Unilab provides some medicines and food. The city government, of course, the vaccines, no, with in coordination with national government. So that's how we crafted the memorandum of agreement. We define our tasks, and it's a beautiful concrete partnership that we experience here. So we made it public in last June 21, 2021. And then this October, we tried to made we made an evaluation. So far, we were able to help vaccinate 65,000 individuals and more than 5,000 senior citizens in one area. This is just an example of one diocese having this concrete contribution to the rollout of the vaccinations. Okay, next slide. Now, what's the lessons we learned from here? Or we say takeaways. The things that we have realized also, and we want to share this with you. No, that the effective COVID response is really better done with a comprehensive approach. We call it whole of nation or whole of society approach. We need to have a clear direction. We mobilize everybody to be part of it, and we write messaging. You know, we use also our churches, especially during Sundays, for registration. We encourage our parishioners, churchgoers during the Mass. And then after the Mass, there are tables outside for registration. And that helped a lot in terms of encouraging people to be vaccinated. You know, our experience last year, there is that vaccination hesitancy. And the church, the Diocese of Novaliches, and all our Caritas centers help in the communication, help in the promotion of the vaccination program. It helps. This is one way of helping, no, the church as an instrument in terms of promoting, no, the use of the vaccines, the usefulness of that vaccine. Second, you know, we realize that local churches should be involved, especially in the far-flung areas, because our parishes, our local communities are everywhere, no? Through these local churches, we can reach out, no, people in remote areas, and we can communicate with them and we can really share with them about the program, and this helps a lot in our response. So the trust of the public on the vaccines, and their our response to their questions, and our encouragement for them to be vaccinated. There is really a big role for these local churches to have that kind of campaign. And then third, I'm sure this is understandable, that partnership is always effective in any program like this. It's a COVID response, and it's a pandemic, and everybody should be involved. And I'm happy that in our partnership here with government, with private sectors, we are able to establish some kind of a system. And one of the experiences of vaccinees here, that they are more comfortable, they are more trusting when they come to our venue for vaccination. There is an order, there is a good facility, and we have trained volunteers, and this is one contribution of the church environment for this vaccination program. So that's very important. Now, our experience tells us that it's good to have a clear, established system for the vaccination program. Second, we are able to perfect our system in terms of contact tracing, in terms of encouraging people to follow the minimum health protocols. And we are able to send the message, the importance of these protocols in protecting not only themselves, but protecting others, and especially their families and communities. And of course, through our communication, through our information dissemination, through our spiritual encouragement, we are able to instill in the minds and hearts of our people safety and security of everybody when they come to our places, especially church grounds, and then we are able to encourage them to think also of safety and security of others wherever they go. So they become more and more open to that kind of orientation. So these are some learnings that we have. Now, until now, our venue is still open. We are now vaccinating the minors, 12 years old to 17 years old. And we continue our partnership, and hopefully this will go on, and we will vaccinate. We can vaccinate more people, and we can also help them spread that good news of the vaccines. So that's it. We thank again our partners in government, in the private sectors, and then we thank our volunteers who continue to risk their life, and I thank you also for giving us opportunity to share our experience. God bless you all.
Thank you very much, Father Tony, for your presentation, and thank you for the great work that Caritas Philippines does in protecting the vulnerable during this pandemic. It's great to see how the CBCP macro level support in the public health emergency response is also being seen and translated in the work by the examples that Caritas has explained over their presentation. If participants or guests would like to ask questions, there is a Q&A box at the bottom of the screen where you can type your questions there. Feel free to share your questions. And I would like to turn you over now to Dr. Kira Fortune, our coordinator for social determinants of health and violence and injury prevention from the WHO Western Pacific region, to moderate our panel discussion this afternoon. Dr. Kira?
Thank you so much, Ava, and good afternoon, colleagues, and greetings from Manila. It is a privilege to be part of this really important and very timely discussion today. I have the grand privilege of moderating the second part of this discussion, and we have some exciting panelists with us. In fact, we will be looking specifically at good practices. So without further ado, I'm going to introduce to you our very first panelist, who is Ms. Arlene Arbas. Ms. Arbas is the Chief of the Media and External Relations Division at the Department of Health at the Health Promotion Bureau in the Philippines. And now, Ms. Arbas, I would like to acknowledge that you have engaged in some very interesting collaborative work with faith-based organizations for the Raspakuna initiative. And I know that the Department of Health has actively engaged faith-based organization for vaccination rollout even before the COVID-19 pandemic. Ms. Arlene, could you share with us how the Department of Health has been able to keep this engagement sustainable and make such a significant impact to communities? Over to you.
Thank you, Kira. Let me just share a few, actually it's 2 slides to explain the collaborative work we had with the faith-based organization. So let me start by stating some reason why we collaborate with the faith-based organization. So we all know that the faith-based organization is a valuable resource in disseminating correct information on Raspakuna campaign, the Department of Health's nationwide campaign against COVID-19 and increasing demand for vaccination. So they represent credible and caring members in which the community has confidence. And faith-based organizations are already on the front lines where community issues are first identified at a point where they can be resolved. Of course, faith-based organizations share the common goal of the Department of Health for a healthy community, yet operate within a different framework to reach targeted individuals. Of course, also they are a part of every community, not apart from them. So community members are comfortable dealing with them as they are one with them in the community where they live. So how does the DOH collaborate with faith-based organization? Next slide, please. So prior to collaboration, the Department of Health prepare advocacy plan with clear objectives and possible areas of collaboration. In the plan, our requests for partner support are already outlined. So we activate the database of the faith-based organization and identify and look at locating other faith-based organization. Then we initiate the contact. First contact is a call explaining our plan. Then we formalize the invitation through an official letter. And then we organize the meeting with key officials of both parties. It is important that the first meeting should be attended by our key officials to stress the importance of engagement. Then we collaborating with our faith organization can be classified into information sharing, partnership. They serve as an outlet of health information in various platforms. As explained by Father Dan and Father Tony a while ago, they reposted our Raspakuna materials in their social media pages, broadcasted radio and TV materials in their platforms. And then another category of our collaboration with our faith organization is the coordination and cooperation. So they take the supportive and facilitative roles, conduct town halls and outreach services in their local chapters, dioceses, branches, and others. So Kira, about your questions on how has the DOH been able to keep this engagement sustainable, we keep this engagement sustainable by observing the principle of trust, effective communication, and mutual ambition. We consider our partners as part of our team with a distinct role to play in the achievement of our common goal. We enter into a memorandum of understanding for a clear delineation of works. We make our partnership as valuable as it can be. We learn, grow, and benefit from each other's knowledge and experience. Collaboration allows us to know more than we are capable of knowing ourselves. We share resources in the delivery of health information and services. And then prior to pandemic, we communicate with them using our voice rather than emails or text messages, because in writing, tone and intentions can sometimes be misinterpreted very, very easily. We are open to discussion and more inclined towards solving problems. We mutually work hard, work smart, and work with the heart. These are the things we observe to keep our engagement sustainable, and it works such that we were able to address vaccine hesitancy and therefore increase demand for COVID-19 vaccines. We know that we need to do more advocacies in some part of the country, but we are certain that together we will win this battle against COVID-19. Thank you very much. Over to you, Kira.
Thank you so much, Ms. Arbas. You have very, very clearly shown how faith-based organizations are at the very heart of many, many communities, and how with effective community engagement, mutual goals can be defined in order to reach those that are most vulnerable. So thank you very much for, again, also highlighting the importance of trust and how to engage communities in a very meaningful manner. Now, colleagues, I would like to turn to Pastor Choy Magdaong. Pastor Choy Magdaong is the manager for faith and development, World Vision here in the Philippines. And now, Pastor, we know that mental health support, especially in times of a global pandemic, is absolutely vital to good health and well-being in communities. Now, the mental and spiritual aspects of people's lives are, of course, often intertwined. So, Pastor, we'd like to hear from you what initiatives World Vision supported to deliver sustainable and person-oriented mental health, as well as psychosocial support services and systems. Over to you, Pastor.
Good day to all. Good day, Kira. Here in World Vision Philippines, as a Christian organization, aside from providing help in terms of vaccine rollout, one of our focus is the mental health, providing mental health during pandemic. And we train the churches from various organizations. It's a community-based training until now that we're going to provide mental health during pandemic. Next slide, please. I would like to share some of the lessons that we learned and what we realized during this time. The church is the best option to help the government to promote and to protect the well-being of our Filipino people. And the church has the motivation, the resources, and the goal that can serve the purpose of the issue of mental health. One highlight of our initiative is that we realize that the Christian faith teaches us that the fullness of life is in loving our neighbor as we love ourselves. Mental health endeavors takes place in the context of relationship. Studies show that the relationships that are healing and empowering are those that are characterized by acceptance, respect, warmth, and caring. And here are some of the learning that we have. Next slide, please. During the course of our intervention, especially the training that we provided to churches, we found out that the role of the church is an advocate of mental health. The formation of character is an essential calling of the church. And when the church brings mental health to others, the church is helping to facilitate the nurture of the image of God, especially during this time of pandemic. And we also realize that one of the role of the church must then become the discernment of the need for mental health or the psychosocial support and services. It resists forces toward hopelessness and stabilization, and develops strengths and competencies not only to survive, but also to thrive in the face of this pandemic. Next slide, please. And also, the church is a natural mechanism where such education can take place. For example, we do that during the worship services, the prayer meeting, the Sunday school for children, the Bible study groups and fellowship and meetings. And the psychosocial spiritual support of the ministry of the church can be offered informally in the context of a free church-based psychosocial support and mental health. Next slide, please. And also, the church is a deep bench of persons who can be given training to become more effective in helping people who are sad, lonely, and feeling hopeless during this time of pandemic. In our intervention and also in training, doing the training of psychological first aid, mental health, and self-care for church leaders, we realize that the church can be a source of people who can help us to give more training, especially on the issue of mental health. And for us to be more consistent about our motivation, that it can be an initiative that can be for long intervention during this time of pandemic. The mental health or the psychosocial support that the training that we provided, it is a community-based, it is a church-based, and we are hoping that the church will adapt the training and they will roll out it in the community even without the presence of World Vision to become more sustainable. And it is our prayer that all churches will work together to provide mental health and to help people during these difficult and trying times. Thank you, Kira. Back to you.
Thank you so much, Pastor Magdaong. And for me personally, it was very interesting to hear how we can really leverage from church existing mechanisms and networks to really be able to deliver mental health and psychosocial support, either formally or informally. So again, thank you for sharing those really important insights. Colleagues, next I'm going to turn to Mr. Ronillo Oyanip, who is the program manager for the Philippine Children's Ministries Network here in the Philippines. Now, during the pandemic, new innovative ways of creating safe and healthy environments for children using key technology, including that of a phone mentoring program of the Philippine Children's Ministry Network, has been put in place. So, Mr. Oyanip, I would love to hear from you how you plan to expand the phone mentoring program to make sure that it more effectively delivers the information that families need in this pandemic. So over to you.
Thank you, Dr. Kira, and on behalf of the Philippine Children's Ministries Network, thank you for inviting us to be part of this global conference to share with you what we have been doing as an organization. So the Philippine Children's Ministries Network is a network of faith-based organizations and participating churches and individual members with ministries to, for, and with children at risk. Even during the pandemic, PCMN did not stop to find ways to reach the target communities. One of the more recent best practices is the introduction of the Child and Family Phone Mentoring Program, fitted in situations whereby families and staff cannot meet face-to-face but can communicate through phone. The Phone Mentoring Program is an initiative of Viva and PCMN to mentor families using resources sent through phone calls over 8 learning themes. The phone calls are participatory and engaging and support proactive actions for family on its topic, which covers COVID-19 awareness, building a strong relationship within the family, mental health and resilience, staying safe at home, staying safe online, online sexual exploitation of children, among others. The phone mentoring program was implemented and is being implemented in the areas of Dasmariñas City, Iligan City, Antipolo City, Rizal Province, and Davao Region, Albay Province, and Bacolod City. Based on the interviews from program participants and mentors, the program has a significant impact on the safety and well-being of families. In order to provide valid and fact-check details regarding COVID-19 awareness, which is part of the phone mentoring themes, the mentors always endorse the program participants to refer to the latest DOH and WHO released fact sheets to be enlightened about the situation of COVID-19 in the Philippines. To further increase the knowledge of the PCMN team and the volunteers on the area implementation, PCMN invited speakers from WHO to orient on the COVID-19 vaccines last April 2021, where the learnings were used in specific activities in the project areas and regional network of the organization. PCMN also partnered with WHO Philippines to update the network members and partners on COVID-19 Delta and Lambda variants during the National Prayer Gathering held last September 23, attended by 83 participants. The theme on COVID-19 awareness is a crucial factor in the phone mentoring program as it serves as a platform for families to learn about the pandemic in the language, dialect, or in the same level of understanding with the mentors. Through this strategy, they will be guided on how to process technical information about COVID-19 and relate to their family members. In partnership with our donors and funding agencies, PCMN will continue to train mentors for phone mentoring program in areas where there is a presence of our organization and network members to reach more families and to raise more awareness on COVID-19. As long as we have the resources and the means, we will continue to do what we have been doing to educate families about the pandemic, its impact and preventions. It is our way of contributing to WHO and DOH education and awareness campaign and fight against COVID-19. That ends my presentation. Over to you, Dr. Kira.
Thank you so much, Mr. Oyanib, for sharing so generously with us your insights. And again, clearly the mentoring program, which engages the entire family, is really a sort of a sustainable and holistic way of ensuring that the family as a whole, no matter gender or age, has a common understanding of how to stay safe. Colleagues, I'd like to thank all of our panelists for again being so generous in terms of sharing your knowledge and insights with us. I'm now going to hand over the floor to Dr. Beverly Lorraine Ho of the Health Promotion Bureau and Disease Prevention and Control Bureau, Department of Health here in the Philippines. Dr. Lorraine Ho will deliver her closing remarks for this session. So Dr. Ho, the floor is yours.
Thank you very much, Kira, and good afternoon, everyone. I hope you enjoyed the last hour. First of all, allow me to extend my congratulations and gratitude to WHO and Religions for Peace for organizing today's learning session. And to the presenters this afternoon, many of whom have been our long-term partners, particularly in our childhood immunization campaigns over the years. Let me also just say, it has not been easy all the time, as you have seen. Of course, there will always be discussions, disagreements, but at the end of the day, what is important is that we do have an open, trusting relationship with our partners, and we do the best that we can for the Filipino people. So from the inspiring presentations, one after the other this afternoon, I tried to summarize 3 key points that we want to probably take home from today. First is that health for all, by all. So no single organization, not even the government, can fulfill all the health needs of our people, especially when we consider health as encompassing physical, mental, and spiritual health. And when we also acknowledge that 80% of a population's health is actually outside of the health sector. That means all the social determinants. Second is that innovation and collaboration will be needed across the care spectrum. This means from health promotion, disease prevention, to actually treatment and recovery or reintegration in the society. We've seen a lot of examples from the presentations a while ago, and particularly for us in the Philippine context, we have a low pre-pandemic health literacy already, as well as already existing gaps in health facilities and health human resources. We will really need all the help and innovation in order to deliver the services that are required during the pandemic. It's not just sharing of information, debunking misinformation, but also really providing outreach services for the poor. And then finally, we also just need to recognize that our partners are also our constituents. I think this is something that I really wanted to be able to share because very early on, we have been able to engage many of our religious groups in the advocacy part, no? But much later into the COVID pandemic, we realized that they were also having difficulties within their own congregation in terms of, encouraging their members to get vaccinated, for example, right? So like from a leadership standpoint within the organizations, yes, we can tap them, but within their organizations, there are also communities that will also need our help, perhaps, in order to deliver what needs to be delivered for their constituencies. So with that, just allow me to close this by saying thank you to my very own Health Promotion Bureau team who has been working so hard since the start of the pandemic on communicating risk to the public, engaging many more organizations, and as well as going into this vaccination program, really working very hard. So with that, thank you very much. And I give the floor back to you, Kira.
Thank you so much, Dr. Ho, for those very inspiring words, and also to all of you and your colleagues for the amazing work that you're doing. With that, I am going to hand back over to my wonderful colleague, Ava. Over to you, Ava.
Thank you, Kira. And thank you very much, Dr. Beverly Ho, for the work, for all the work that you do for the country's COVID-19 response. So that concludes today's event. For participants with unanswered questions, we will reply to your questions via email or direct messages. We hope that the best practices shared today will continue to inspire governments, faith-based partners, and communities in further strengthening national responses to health emergencies. Thank you, and I wish you all a pleasant day. Mabuhay at maraming salamat po. In the Philippines, before we end any session in Zoom, we would like to have a photo session. So I'd like to have a very, very quick one whilst all the participants, the speakers are in the same Zoom room. And then I'll hand over back to Sarah for the final closing.
Thanks, Eva. I've put on the screen into gallery view, at least on my side. So feel free to take a picture. And I don't need to add anything. I just want to extend my thanks to everybody for the wonderful collaboration and a very successful webinar and case study. As mentioned previously, the recording will be available on YouTube in English and then in the 3 languages, Spanish, French, and Arabic as well. We look forward to continuing the conversation with everybody going forward, and we really do wish you a safe rest of the day. So thanks everybody for your participation. Take care.